Welcome back to Out of Network. I'm Dr. Ryon Parker here with Dr. Rishi Seth. Today, we're going to talk about something a lot of people are really curious about. A lot of people are honestly nervous about. And to be honest, something most doctors still feel very uncomfortable discussing, and that's psychedelics in medicine. Ketamine, Psilocybin, MDMA, these treatments are getting a lot of attention for depression, anxiety, PTSD, and conditions that don't really respond to traditional medications. And we're seeing patients bring these questions into our clinics more and more.
We're not here to hype up psychedelics or push them as a miracle cure, but we are here to talk honestly about what we've seen, what we worry about, and where the science actually is, and the real stories from patients who've tried everything else and are still suffering. And in today's episode, you're going to hear a personal story that you may not expect, one that adds a whole new layer to this conversation.
So let's dive in. No hype, no judgment, just a real conversation about what these therapies might mean for the patients who feel like they're all out of options. Today, I want to talk about a topic that's been getting a lot of attention in medicine, and I think I want to start with a clinical scenario that I've personally come across, and I'm just curious to get your thoughts and what you would do, and would you be that doctor that thought outside of the box a little bit? So let's say you have a 40-year-old female who's struggled with anxiety and depression her entire life. She has a psychiatrist already on board. She's on 4 different antidepressant mood stabilizers, and she comes to you and she says, Dr. Seth, I am still not doing well. I am struggling in my everyday. I have had, ongoing thoughts of suicide my entire life. I'm certainly not thinking of that now, but I'm just kind of at my wit's end. Nothing is working. I see a therapist. The psychiatrist just continues to give me medications. I'm not doing better.
Mm-hmm.
What do you do?
I'm not gonna lie, I have no idea. In a hospital setting,
mm-hmm.
we see a lot of patients that have been described as quote unquote end stage.
Mm-hmm.
And I'm gonna be honest with you, one of the most difficult things that I've ever seen in my life has been end stage patients with eating disorders. So they happen to have, depression, anxiety, many underlying mood disorders, but then it manifests in eating disorders. And I could tell you that there's a eating disorders doctor that I work with very closely, Dr. Jorgensen in North Dakota, and she used the words, there's cures for cancer. There's no cures for eating disorders or these kind of mental health illnesses. So I struggle with what to do next.
Yeah. I mean, I think as a physician, we need to we can't just say, I'm sorry, right? I mean, I think we have to obviously give a plan B or a plan C. And maybe sometimes that is, I'm here to weather the storm with you, right? So this is a scenario that was brought to my attention by a patient. And trying to think outside of the box a little bit, this hot topic I'm referring to is the use of psychedelics in medicine. So whether that is ketamine, MDMA, which is ecstasy, LSD, psilocybin, which is medical grade mushrooms, would you entertain the idea of recommending that for this patient?
No. And I'll tell you the reason why.
Mm-hmm.
Because I don't know about that wheelhouse.
Yeah.
And then in this case, I've been if the psychiatrist didn't recommend it, then what am I going to add to that?
Would you be afraid, if you had a resource, would you be afraid to refer to that entity, business?
Oh yeah, definitely. I would 100% be critical of that option.
Why?
I mean, it's not FDA approved.
Mm-hmm.
There's studies ongoing, but it's not like there's robust data to support that.
Yeah.
I mean, there's anecdotal patient experiences where they've done psilocybin, mushrooms, LSD, ketamine,
mm-hmm.
and maybe it works for some people. But truthfully, if it was the cure, then it would be everywhere,
Yeah.
right? And it would be more generally accepted.
Do you think that it isn't because there are so many governmental restrictions on advancing the science, advancing the studies?
Yeah, I mean, I think LSD and I think psilocybin are still under the DEA Schedule 3B or whatever that is.
Yeah.
So
It limits.
yeah, there's limitations to it.
Yeah.
Yeah.
So I'll tell you that this is a situation that was brought into my clinic, and I was made aware of a retreat in the state of Colorado that offered this type of potential treatment or therapy for patients who have kind of this refractory depression, refractory anxiety, when all the typical medications are not working for them. So this is it's ran by an individual who has a doctorate in psychology. It is a place that, with much trepidation, I had reached out to her and got some information and basically provided the referral.
So you found the place?
I did.
So patients had no idea. You look for this resource.
Correct. I mean, in my research, looking at what's closest to me is the University of California in San Francisco, that has several clinical trials currently looking at patients, whether or not there's a benefit to this therapy in refractory depression and anxiety, and even looking at enrolling her in these programs, there was nothing available.
So there was like. And I'm assuming these are pharmaceutical or NIH grant studies? Okay.
Yes, correct.
Okay.
Correct. So reaching out to this entity, very professional. I had basically gave a rundown on the patient situation and presented this to the patient, for which she was actually, for the first time, pretty excited about just an option. I said, I don't know much about this. I'm kind of turfing to the expertise of this individual, and I pray I'm not providing you misled information.
Sure.
Again. So
this patient was already seen by psychiatry, was already seen by you.
Already psychiatry in place, counselor in place, on maximum medical therapy. So polypharmacy, basically, and not doing well.
I think people need to understand that. Like, I don't want to use the word end stage, but very difficult to treat mood disorders. They have like a bag of medications.
Yes.
And they're mood stabilizing medications. And one offset, like truthfully, these medications do counteract each other.
Sure.
They have side effects, but these patients have been experiencing these symptoms for so long that if you take one of these meds off or you stop the meds, like they have refractory symptoms off of it. A lot of times, like really bad anxiety, severe depression.
And we worry about, that's why a lot of times we don't like to manipulate these meds, because you can make their symptoms a lot worse. There could be an increase in suicidal ideation. So there is a big risk. So we presented this option to her, for which she had reached out to this entity, got information, submitted paperwork, and she was enrolled to participate in this week-long retreat. One of the requirements was she could no longer be on any of her typical antidepressants or mood stabilizers. So that was the rule. She had to be off all of them.
How many was she on?
4 or 5. Yeah. So
no benzodiazepines, I'm assuming.
No. PRN as needed.
Okay. No, the reason why I say that is like, you can risk the seizures and withdrawal of benzodiazepines.
Correct. So it wasn't like we just made the referral and she was there the next week. Sure. So this was really thoughts. I mean, we thought about this pretty intensely and came up with a game plan under this entity's recommendation. So over the course of 2 to 3 months, we slowly weaned off one by one her meds, and I was seeing her pretty religiously every 2 to 3 weeks. If not sooner than that. But we got her off of the medicines, and yes, as expected, she was not in a good place. So her husband ended up helping her make the trip to Colorado, and she participated in this week-long retreat, which was, I don't think she did a private retreat, which there are options for, but she worked individually with this individual, and then participated in these group therapy sessions in a very calming space. And again, I don't know the details, but fast forward a month after this, she came to me and said, Dr. Parker, this is the first time that I feel so much better. I don't think I need my medicines anymore. And it was almost like it caught me off guard because I said, are you sure? You've been struggling with this your whole life. She said, I absolutely feel this was the best thing I have ever done.
So when she goes to this like farm.
Yeah, it's a retreat in the mountains.
Farm,
Mm-hmm.
right?
Mm-hmm.
So she goes out there. Do you know exactly what she takes?
I think it was a combination of psilocybin.
Mushrooms.
Mm-hmm.
Okay.
I think it was very focused counseling.
Okay.
Individual therapy and then group sessions. I think there was also some marijuana. Okay. All right. I know where you're going with this. There was marijuana and obviously clean eating, detoxing, the whole 9 yards.
All right, I'm just gonna stop you right here. So I'm just gonna summarize this, like how ChatGPT summarizes our stuff. All right, so you have a patient who you safely walked off the medications over 2 weeks.
Mm-hmm.
Her symptoms are probably at the peak. Right?
Yes, yeah.
And then she goes out into the mountains, beautiful, clean air.
Yeah.
Gets high for a full week, gets fed in a group setting where other people are getting high and probably hugging each other and loving each other, sharing all sorts of experiences. And how much did she pay? $10,000?
Something maybe along those lines. Yes. Yeah.
Ryan,
Yeah.
I have a good idea.
Okay.
I've got a business idea. I've got this great idea. It's outside of Tampa. There's a beach out there. Just get a bunch of people high. All right.
You're no longer doing concierge medicine, right?
Concierge psilocybin retreats.
So I know it sounds crazy, but this worked for her. And whether it was a placebo, I think in talking to this patient, this was something that she has struggled with since being a child. And I don't know if truly there was something in that drug that allowed her to push through. Was there an awakening? What was it? Just happen chance, or was that truly the effect of a drug that rerouted that neurochemistry that her previous SSRIs and mood stabilizers could not do?
So let's talk about a little bit about like how this works. So, and she had depression and anxiety, and she had suicidal thoughts.
She did.
Okay, but no like psychotic disorders and no bipolar disorders.
No,
okay.
No.
So for the general public to understand this, and this is something that it takes me a little bit of understanding too. So patients who have bipolar disorder or they have manic episodes or psychotic issues, psilocybin or mushrooms will worsen those symptoms because it can make you hallucinate, right? So
Correct.
So those patients, it's not recommended for. For some patients who are refractory depression, refractory anxiety, psilocybin can be an option. So, but I mean, like in this case,
in a guide, like, and again, does this give permission to say that, oh, it's going to work for everybody and that you should go and get this on the streets? I mean, I think every person's experience is going to be different, but I think it would need to be in a guided, truly, truly safe place.
Right.
Johns Hopkins did a randomized control trial that showed a single dose of psilocybin can produce rapid antidepressant effects that can last anywhere from 1 to 12 months in many patients.
A single dose.
A single dose.
So like, how much mushroom? Let's be honest. Like, what does this look like in a?
Yeah. And
what
even
does a single dose mean?
Right. Right. And
and
the concentration.
Yeah.
And is it daily for 6 days?
Yeah.
I maybe we'll have that data in the future, but it was even comparable to Lexapro, but with a faster onset and had greater improvements in overall emotional processing. So it was interesting. And, obviously this patient is still in my practice. I do see her routinely. And yes, I feel like there has been great strides. Again, she had told me that she did not want to go back on her medicines. I think, fast forward several months, I think we're even past a year now at this point. Yeah, I have put her back on an SSRI.
Okay.
But
would she consider going back to that retreat? And
so that's the discussion. There is a talk about her wanting to go back.
So now you got someone who is on an SSRI and then goes off the SSRI or however many SSRIs she was on, and then gets high for a week and then and comes off it and then feels a lot better. There's whenever you ask people who have tried psilocybin, they don't talk about the rewiring of their thing. They kind of experience I guess there's an experience and almost like an out-of-body experience, and it's like an awakening of some sort. So it's more like it's almost a sped up psychotherapy. Right. As opposed to like a chemical imbalance restructuring.
Right.
So I know, I mean, it makes sense from the theory ideas. I just,
yeah,
we got to wait and see.
Well, it's, I think if I could share a little bit of my personal experience, obviously going to college, and I think, as I mentioned in a previous podcast, my second year of medical school was very challenging for me. Coming to terms with my sexuality, I was really in a dark place. I had failed 2 courses, really was lost. And I don't know I think it was multifactorial, but I'm not going to lie to you. I had tried something at a time that nothing else was really working, and I was maybe grasping for something. And for me, I felt that there was almost a change that almost either really catapulted me into a different direction or scared me enough to want to be into that direction.
Can you explain a little bit about that?
Yeah. And I'm not talking about I went on a wild trip.
Right.
I was with friends. I trusted this environment I was in, and it almost like there was a light bulb that turned on that honestly suddenly made sense. I won't necessarily go into too much detail, but my childhood, I was very much loved and had all the security blankets I needed, and I was not poor necessarily, but I think I grew up in an environment, had kind of an overbearing mother and an absent father, and it was somewhat of a challenging childhood for both my sister and myself. And I don't want to blame my parents necessarily. I think they did the best that they could, but I knew that I may not have had the best childhood. And when you're in these situations, it will either catapult you into this direction, or you can kind of say, I'm better than this small town I was growing up in, right? So, my mom has pretty significant OCD. I slept on the floor for 18 years of my life.
Why was that?
My mom was just very, very particular, perfectionist, clean. Everything had to have everything was in a certain place. I did homework outside when it was 20 degrees out. There was just certain rules that we had to follow. And, for the longest time, I kept that very much hidden. But having that experience I had mentioned, it allowed me to kind of talk more about it and work through some of these things. You either have resentment and harbor this and affect your life, or you do something about it, right? And for me, maybe it took doing that to make me realize where I needed to go.
Do you think also the stress of that moment when you were in school, where you had probably the most difficult, as some people describe as the bottom?
Mm-hmm.
Do you think maybe you just hit the bottom?
Yeah.
And maybe that was part of it?
Yeah, I definitely did. I was in love with someone that didn't love me back, and that's sometimes hard to swallow. And sometimes, when you don't feel necessarily loved, that you start really questioning other things and maybe start saying maybe I'm not good enough. And maybe that's why my mom did what she did and my dad was absent. So did that condition me to believe certain things? And was I the biggest reason for the collapse of that relationship? Who knows? But had I, it's easy for me to look back now. Had I not had that experience, where would I be? And yes, maybe I did hit rock bottom. I don't know. But I know, why was I given another opportunity to make a success for myself? When you see other people who are maybe born into worse situations and they follow along that same trajectory, you know what I mean? And they stay confined to the limitations of that small town. And they maybe, not to say it's bad, but they do what their parents did, and they didn't go to college, and they didn't have other higher aspirations. Why was I so different?
There's a lot of philosophical discussion about the use of SSRIs in the public right now. And a lot of the discussion is about how SSRIs almost numb people from the pain.
Yeah.
And it's almost like the psilocybin journey and the journey that you experienced was the opposite. It was like full frontal opening, like really delving into it at a really fast experience and then moving on from it.
Yeah.
Now, I'm not saying that's the science behind it. But like there's a lot of people questioning the science behind SSRI right now.
Sure.
And it's a reasonable conversation.
Just on one, it definitely numbed the emotion.
Does it?
Absolutely. Yeah. It was hard for me to come off of it. I didn't like the side effects. And having gone through that myself, it's hard for me as a doctor to really push that therapy.
Right.
I would say I've been there before.
Right.
Been there.
Yeah, sorry, go ahead.
And I was even saying, even sharing this about my childhood, and, even that part of me is feeling guilty for even bringing that up, right? I love my mom and dad, but they did the best they could. We all have issues, I guess, and maybe my mom had her fair share. I don't know really what fostered that, but it definitely affected my sister and I, but it's easier for me to talk about now. And yeah, some people, as you said, you did what? You slept on the floor for 18 years? Yeah, my mom was a clean freak. My mom didn't want us to dirty anything. We couldn't use the desks, we sat on the floor. We sat on a picnic table outside in a garage when it was so cold out. There were certain rules that we had to follow. I could tell you more stories, but all I can say is when people are running out of options, it's a very scary place to be.
Mm-hmm.
And yes, we don't have the data, but why can't we as doctors provide just an avenue? We may not know. I'm not a cardiologist. I'm not a surgeon, but I'm going to refer to them. I'm not an expert in these psychedelics, but maybe we could find those people that are. Right.
And I think that's a reasonable approach to think about that. And there's, like you described, there's many places that are currently researching this. I think the problem with that research part is like there's governmental interventions, there's DEA classifications,
right.
And then there's, like, truthfully, it's going to be access too.
Right.
It's going to be another medication that's going to be extremely expensive.
Right.
And it's not going to be available to everybody, and it's going to be expensive, and insurance companies. So like we are essentially 5 to 10 years before it's mainstream if it gets approved. Right now, most of the studies are in phase 2 or phase 3.
So why is there, is it a safety thing? Is it just, is there some anecdotal evidence that proves that this could work? Why are there?
I think there's anecdotal evidence. There's from yourself. There's from the patients that you experience. I know I have patients myself, not patients, friends of mine that have tried it, who have experienced very positive experiences from it. I've had friends who've had negative experiences from it.
Sure.
So I think before we approach it as a treatment for certain conditions, I think it's really important for us to know who it's not for.
Right. Well, and I don't want it to be a treatment that just gives people an excuse to get high. And I
Like going out in the mountains.
Right,
That was the,
right. I think if that was the case, they could easily go to North Las Vegas and find that, right?
Yeah.
I think for those individuals, and let me just be very clear, this is a center that CEOs of companies go to.
Really?
That we're not talking, it's truly people in business fields, doctors, lawyers, successful people who are really looking for other alternatives.
Oh, it's interesting because like the world that I've worked in for so many years in inpatient hospital, I've taken care of so many patients who have been suicidal, like 4 or 5 times suicidal, attempted suicide, actual attempted failed suicide, eating disorders units, and like oftentimes you look at their med list and you're like, why isn't one of these working? Like,
Okay.
and then sometimes and then like you look at the psychiatrist note the next day and they're like, continue all meds, increased dose of this. And you're like, really? Do you really think that's going to be it?
Right.
Now, that's also my thought because I don't know the answer to this.
Right.
And like, there is so much more to mental health than just my simple nuance of it.
Right.
But, there's obviously behavioral therapy is important with psychology and psychotherapy. Obviously, there's some form of medical treatment. A lot of people do experience benefit from SSRIs and it works for a lot of people.
It's interesting for me that, having been on one and then having that experience to now, like I don't struggle with depression. I really don't. I really don't struggle with anxiety. I mean, we all do, but it's not pathologic, right? It's manageable compared to where I was before.
Right. So
Please.
Do you mind if I ask?
Yeah.
So who and why did they put you on an SSRI if you didn't have those symptoms?
No, it was at the time, like I was
during that episode.
Yeah, prior to that episode.
Oh, I see.
I had been struggling. Like I said, I was in a really dark place in medical school.
Right.
And
when did you come off of it?
So I had actually weaned myself off of it before I had this interaction. And so I just, after that, I never went back on it.
So you weaned yourself off, you had the bad experience, and then
I weaned myself off and again I just was struggling.
Right. Did you consider going back on it?
Oh, absolutely. Absolutely. But I knew I didn't like the side effects it was giving me either,
Interesting.
And I had already went on and off of it multiple times, but I didn't like how it just numbed me. I'm a happy-go-lucky guy. I like to laugh, have a good time, but I was just very numb. And I don't want to discredit SSRIs because I do prescribe them. I think like you said, they do work.
Yeah.
They sometimes don't work.
Yeah.
But
and the side effects profile for you was not beneficial.
Correct.
Yeah.
So does that mean we up the dose?
Yeah.
Does that mean we try on a different SSRI? Do we try on a TCA? Do we go to a mood stabilizer? I didn't think I was that bad, right? No. I just knew I was not happy. And maybe it was situationally. Yeah. But that compounded on that really put me into a dark spot.
So we have like all these options out there. So we talking about psilocybin, then there's like LSD, and then there's ketamine. And ketamine is a lot more open in the public. Right. So my experience with ketamine has been in the hospital. We've had it for 3 or 4 reasons. One is obviously anesthesiologists and CRNAs use them for anesthesia.
Right.
It's a great pain medication, preoperative options.
Scared to be used in peds.
Sophia had it. Yeah.
What'd she do with it?
So I have a picture of her. She had a laceration underneath her lip.
Yes.
And she was 1.
Yeah.
And the the ER doc was like going to had to put stitches in her. And so in the ER, he's like, I'm going to give her a little bit of ketamine. And I was like, oh, my little baby girl. I was so worried about this like psychiatric medication. I didn't know what the side effect was going to be. And simply they were like, it's anesthesia, calm down. But I was just worried.
Sure.
And then, so she like quieted down. And then 2 loops of a stitch and she was in. And then she was like a zombie for like 5 hours. And Nir and I have a picture of her just staring out like this with her mouth open.
Yeah.
It's really a funny picture. And then she like woke up and she was our baby again. And it was better. But there's that perspective. We've used it for IV ketamine for refractory pain and anxiety and end-stage cancer patients, patients who have like intractable pain, who are in the hospital.
Yeah.
We tried ketamine. That actually works really well.
Would you refer a patient? So in Vegas, there's a lot of ketamine clinics, often operated by a pain specialist or anesthesiologist. Would you refer a patient? Because that was the other option.
Yeah, I'm kind of I'm in that boat where like if you have chronic pain and there's a diagnosis like a cancer, extreme osteoarthritis, I don't know, some sort of disease, pathology, it's reasonable. But when people have like generic severe chronic pain, NOS, non-specific otherwise sense, I have difficulty because in my opinion at that point sometimes we're giving more medications to treat an unknown diagnosis, and I'm not willing to do that.
So I think with ketamine it's not just one and done, and even with psychedelics I don't think it's just a one and done
Exactly.
type of scenario. But I don't know. I don't think that this should ever be used as an excuse to get patients to get high. But I do feel that there could be some benefits. I've noticed with these ketamine clinics in Las Vegas, sometimes it's 1 session a week, 2 sessions a week, 3 sessions, and I think over time that could be very expensive. But
I mean, so like some of the information that we kind of have seen, like the FDA has approved ketamine for some sort of mental health conditions like major depression disorder and stuff like that. So like it seems like there's like a route for it. It's just I think the difficult part that I have is what do you start with first then? Right? Because like they're all approved.
Right.
Then like are they all going towards the IV ketamine in the first place? Well, no. Is that saved for refractory?
And what else in addition to that are you doing? What is the procedure where it's the use of their eyes and the rapid eye movement in conjunction with light therapy and ketamine? Do you know what I'm talking about?
No, I don't. I know of ECT.
Correct. Right.
Shock,
but there's also something have to do with the focusing of the eyes, and it's not coming to me now. But
is this what they do at that mushroom clinic?
They smell and chart. So
this is another thing that we could have out there.
I'm gonna get her on this podcast.
Can I be okay? I promise you, I'll be nice.
And if she is listening, I would love for you to interview her. Okay.
Okay, Dr. Stephanie, I promise you, I will not be. I will be. I have an open mind, but I really like to be convinced.
Yes.
Because I want to know if this is a treatment option. Because right now, like I've seen a lot of patients who are refractory and like there's no solution. I don't want to say there's no option. There's no solution that works for these guys.
Yeah.
And the answer is just come back to the ER 2 days later and, they're in terrible situations. They put themselves in very bad social situations as a result.
Yeah.
They have frayed, fractured family lives as a result. Sometimes substance abuse gets in the way of it. If this is an option, let's go. Let's talk about it.
Yeah. I think, and having gone through some situations, I'm very sympathetic on the subject. I really am, because I know how much patients can really suffer. And like I said before, this is just one alternative that I'm very open to say, hey, I don't know much about it, but I think let's at least try and see if this is an alternative therapy that's going to help.
Yeah. So takeaway is, I think we've got a lot of options out there that are coming on the horizon for mental health,
which is exciting.
Yeah. I think there's a lot of ambiguity in it, and that's the difficult part about psychiatric sciences in general.
Yeah.
There's a lot of ambiguity.
Right.
It's not like there's like this disease and the disease has this treatment and it gets better and you can quantify it. Mood is non-quantifiable. It's all qualitative.
Right.
So it's very easy to get lost in, well, this one kind of worked and this one didn't work. And so I think there takes a lot of in-depth understanding, and we'd love to hear more about it.
Yeah. I think just always listening to the patient, right? And how they're doing, and sharing that journey with them as best as you can, right?
Okay.
And again, there are those patients that, yes, have maybe tried this therapy and it didn't work for them, but that doesn't mean we can't continue to provide other options for them.
Yeah, absolutely.
Great topic.
Awesome.
Psychedelics are not magic, they're not a shortcut, and they're definitely not for everyone. But for certain patients, especially the ones who've hit rock bottom, they may offer a window of possibility that traditional medicine hasn't really given them.
And that's why it's worth talking about. Because when someone is suffering and nothing else has worked, doctors shouldn't just say, "I'm sorry," and walk away. We have to keep looking for options, even if the options are new, uncomfortable, or outside the usual playbook. If today's episode gave you something to think about, hit subscribe, leave us a review, share it with someone who needs this conversation. And as always, shout it out from the rooftops. And if you're in Tampa or Las Vegas and you want real evidence-based care from doctors who actually listen, we'd love to take care of you. In Tampa, visit us at Seth Premier Medical. And in Las Vegas, visit Dr. Parker and his team at Parker Medical. All the links are in the show notes below.
Thanks for joining us. We'll see you on the next episode of Out of Network.